So this is Dr. Benton, who has been a patient, underwent DTR therapy 3-4 months ago. So I wanted to find out from you, Kyle, what you used to experience that you lived with before you had the treatment, and then what you have experienced in the last few months since you had the treatment.
So 2007 is when after ortho a second time, is when I developed symptoms. Started in with my second molars, translated to my muscles. Ended up having severe popping in my left joint, so loud that folks could hear it in the next room. That developed into frequent headaches, tension headaches behind my eyes, that would wrap sometimes behind the ear, behind the neck. Was told that it was due to stress or tension. Dental school, early practicing early in my career.
How old were you then?
That was in 2007, so I was so that was almost 10 years ago, 9 years ago. So 24 years.
Mid-20s you had onset.
Yep. Mid 20s is when it began to become apparent. And from there, I've tried to treat myself over the years with orthotics, night guards, upper and lower. I've had NTIs, anything I could try, I attempted. I did get some relief with the tension, never the headaches or the feeling that when I would close, I was tense all day long, so I would just stay clenched down. My joint, I felt like my joint was compressing up against my disc, so I never felt like I could relax, ever. Had hot sensitivity randomly with my first molars, extreme cold sensitivity, generalized cold sensitivity.
That was for years?
Years.
So the second course of orthodontics, was there a goal that you knew was the purpose of going into braces again?
Yeah, it was to correct. I had a division, class 1 div 2, where my laterals were flared, centrals were more lingualized, so I wanted to correct that. But post ortho, looking back, most of my occlusion was on the second molars only. I had very little canine contact. I did have a little guidance, but not much. But it was to correct cosmetic issues.
So that sort of set you off into starting to have symptoms.
Yes.
And over those 10 years or so, you tried a lot of things, obviously, you just said. And did they bring you true relief, or was it just that it mitigated some of the discomfort?
I could tell a drop in some of the tension when I would wake up in the mornings. It really didn't help with the random or the spontaneous hot sensitivity with lower first molars, mainly this lower left one. Did not help with the joint popping, did not help with the tension headaches. So basically, in my mind, I was just trying to minimize destruction of my teeth, and didn't know what else to really do, because most things that I was taught or that I have read, TMD therapy was always subjective. It was a trial and error basis, and until I went to Dr. Kerstein's course, I did not know that things could be objectively measured. So after I was treated, probably took about an hour and a half. Throughout the process, each step of the way, I was experiencing more and more relief. Although my bite felt foreign, it felt like I had no occlusion on my back teeth. I actually did. I was hitting more with my front teeth, which is actually the proper balance that you need. You need more force in the front. So one day post-op, the popping in my left joint was gone. I have not had a hot, sensitive experience with any of my teeth. Threw the night guard away. I've not had a significant tension headache like I have. had in the past. All my muscles feel extremely relaxed. My jaw really felt like it had dropped several inches. And for the first time in 10 years, I felt like I could actually had space when I bit my teeth together to actually move. I felt like I could actually move them in a circle instead of being restricted due to my second molar bite.
Did you have chewing tension or fatigue or soreness?
Yep, and I hadn't dealt with it in 3 months, so I'd forgotten about it. But yeah, I would get worn out pretty quick eating a steak. I would typically try to eat faster because I knew that my muscles would fatigue if I tried to sit down and actually chew and enjoy a meal. Since then, I've had no fatigue. My function, my chewing is much more efficient. And pre DTR therapy, when I did bite, I could actually hear my second molars. I could hear the friction, and I'm sure that was happening at night too. But I experienced none of that. No fatigue whatsoever.
So you can chew easier now?
Very, very easy.
And did you have a difficult adaptation to getting used to your bite, or was it, not to say it was easy, but the changes, did it take you long to sort of accommodate the newness of it?
No, I'd say a few days. The first couple of days, it did take some time getting used to for the first couple of days. But once after that third or fourth day, it was an experience that you don't know is possible until you go through it yourself. I mean, it's hard to explain how you can feel by something that is, very, very or minimally invasive, and not have to worry about relying on some type of orthotic or splint.
So what would you tell a patient who is experiencing some of these difficulties that you obviously see in your own practice? What would you tell them about your own experience if they were thinking about possibly undertaking treatment?
I would tell them to go for it. The sooner the better. The longer you wait, if you are symptomatic and in pain, the longer you wait, the less chances it will be an easier case. With some patients that we've seen with the canine wear, it is a more difficult procedure, but most of those patients can still get helped. But for patients that do have pain, that are experiencing symptoms that range from top of the skull to the base of the neck, you have to consider it. You need to get measured. An objective measurement of this, of your muscles and the way your bite and the way your teeth come together is imperative.
And you've been treating some people since you took the course? Yeah. What has your experience been with that?
Treated my hygienist, and I've treated one of my assistants. My hygienist has experienced over the years multiple big fillings, moved to crowns, root canals, new crowns, vertically fractured teeth, implants. Most of those involved the first and second molars. And since she's been treated, we just revised her yesterday. After her first visit, she could not believe how much relief she had, how much freedom she had. Very similar to me, she was very, very tense, had headaches all the time, and it affected her work, affected her life, affected her relationships. And she is, you can just see it in her face. She's more comfortable. She's much more relaxed. She's not near as tense. She doesn't carry much tension at all in her bite and her muscles in her face. And she's thrilled. She tells all of our patients. A huge advocate. My assistant that had it done, she's younger, she did have a lot of tension, not headaches, limited opening. And we just revised her, and she similar concept, much less, minimal tension. She feels like she can open more. She feels like her bite and her chewing is much more efficient.